Good afternoon, everyone, and welcome to today's update on COVID-19 in New Brunswick. Bon après-midi, tout le monde, et bienvenue à cette mise à jour sur le COVID-19 au Nouveau-Brunswick. Les porte-paroles aujourd'hui sont le médecin hygiéniste en chef, le Dr. Jennifer Russell, et l'honorable Blaine Higgs, Premier ministre du Nouveau-Brunswick. Speaking on behalf of the province today are Dr. Jennifer Russell, the Chief's Medical Officer of Health, and the Honorable Blaine Higgs, Premier of New Brunswick. Dr. Russell.
Thank you, Bruce. Bon après-midi à toutes et à tous. Good afternoon, everyone. L'ensemble du Nouveau-Brunswick se trouve à la phase d'alerte orange du plan de rétablissement provincial depuis 8 jours. Ce jalon représentait une réalisation de taille, surtout pour les citoyens du Madawaska, qui faisaient l'objet de restrictions plus strictes, y compris une période de confinement complet depuis près d'un mois. Les perspectives continuent d'être positives. For the past 8 days, all of New Brunswick has been in the orange alert level of our provincial recovery plan. Reaching this milestone was a significant achievement, particularly for those living in the Madawaska region, which has been under our strongest restrictions, including a full lockdown for much of the previous month. Our outlook continues to be positive. We are seeing far fewer cases of COVID-19 in recent days, fewer hospitalizations, and no new outbreaks. Earlier this week, we had one day with 0 confirmed cases, the first time that has happened since December 20th. These are encouraging signs. But now that we are all comfortably back in orange, everyone wants to know, when are we going to yellow? And I do get this question a lot. Je vous annonce aujourd'hui que nous devrions passer sous peu à la phase d'alerte jaune. Cette phase ne serait pas assortie du même ensemble de règles qui étaient imposées l'été et l'automne dernier, soit la dernière fois que toute la province de New Brunswick se trouvait à la phase d'alerte jaune. La présence de nouveaux variants de la COVID-19 fait en sorte que la nouvelle phase jaune imposera des restrictions quelque peu plus rigoureuses que celles qui étaient en place l'année dernière. Si tout se passe bien, et si nous maintenons la tendance positive actuelle, toutes les zones de santé du Nouveau-Brunswick devraient être prêtes à passer à la phase d'alerte jaune le dimanche 7 mars. Je me dois cependant d'émettre une mise en garde. Bien des choses peuvent se produire au cours des 9 prochains jours. I'm here today to tell you that yellow is coming. And it won't be the same set of rules that you experienced last summer and fall when all of New Brunswick was last in the yellow alert level. Due to the presence of the new variants of COVID-19, the new yellow level will be a little more controlled than what was in place last year. If all goes well and we maintain the positive trajectory that we are now on, all New Brunswick health zones should be ready to move to the new yellow alert level on Sunday, March 7th. But I must caution that a lot can happen in the next 9 days. If we see a sudden increase in cases or new regional outbreaks, we will keep all zones at the orange alert level until it is safe to loosen these restrictions. If our circumstances take a turn for the worse after we have moved to the new yellow, we won't hesitate to have recommendations around the reimposition of stronger measures, including a return to lockdown where and when necessary. In the meantime, Cabinet has endorsed adjustments to the orange alert level to permit more travel within the province and to allow visitations in hospitals with appropriate safeguards for patient safety. Entre-temps, le Cabinet a approuvé des modifications aux restrictions de la phase d'alerte orange qui visent à permettre davantage de déplacements dans la province et à permettre des visites dans les hôpitaux avec la mise en place de mesures pour protéger les patients. The Premier will speak to these changes shortly. And this is all part of the dance that we have engaged with in the COVID-19 pandemic since it began. We will loosen and tighten restrictions and adjust measures within each level of the restriction as required to keep New Brunswickers safe. However, I know that these changes can be confusing, and we talk about this at the national level as well, confusing and frustrating. And each of us has become deeply fatigued by the pandemic, and these frequent changes can be hard to take. But we must be nimble, and we must be positioned to respond quickly to keep the virus at bay. And keep in mind that this virus is changing all the time, and we must change with it. N'oubliez pas que le virus change constamment et que nous devons nous adapter en conséquence. Aujourd'hui, Santé publique confirme qu'il y a un nouveau cas de COVID-19 au Nouveau-Brunswick. Il s'agit d'une personne âgée de 20 à 29 ans qui réside dans la zone 1, soit la région de Moncton et du sud-est du Nouveau-Brunswick. Le cas est lié à un voyage. Il y a présentement 41 cas actifs de COVID-19 dans la province, dont une personne qui est hospitalisée aux soins intensifs. Today, Public Health has confirmed one new case of COVID-19 in New Brunswick. The new case is travel-related and is an individual aged 20 to 29 residing in Zone 1, which is Moncton and southeastern New Brunswick. There are now 41 active cases of COVID-19 in the province, which includes one person who is in hospital under intensive care. And I ask you to please keep these individuals in your thoughts and your prayers as you go about your day. The new yellow alert level we are planning to introduce will see continued restrictions to limit close contacts, those people that you spend time with while not wearing a mask or maintaining 2 meters of physical distance. And this is something that we've known throughout the pandemic, that gatherings can cause a rapid transmission of outbreaks, so we don't want to see that. We will continue to recommend that everyone limit their contacts outside their immediate household to no more than 15 individuals, your steady 15. You will be able to dine in restaurants with members of your Steady 15 and enjoy other activities as a group. Your Steady 15 may include people living outside your health zone, and travel to visit these friends and family would be permitted. Please keep track of these people, because for contact tracing purposes, Public Health will be very appreciative of that information in a timely fashion should there be an outbreak. We recognize the importance of contact with others in maintaining good mental health, and we must also be able to swiftly trace and isolate contacts when outbreaks occur. The fewer close contacts each case has, the more effectively we can do this. This is so very, very important. This new rule is more restrictive than what had been in place at the yellow level last year, but with the variants that can be transmitted more easily, it is very, very prudent to keep your circle of close contacts relatively small. À la phase d'alerte jaune, il faudra continuer porter un masque dans les lieux publics à l'intérieur, mais pas à l'extérieur. Évidemment, il continuera d'être important de respecter les consignes de distanciation physique. Des mesures moins restrictives seront imposées aux centres de divertissement et aux lieux de culte afin que davantage de personnes peuvent fréquenter ces établissements en toute sécurité. At the yellow level, masks will be required in indoor public spaces, but not for outdoor activities. And of course, maintaining physical distance will remain an important practice. There will be less restrictive measures for entertainment centers and faith venues so that more people can safely participate in these activities. Team play for sports leagues will be allowed across zones, and multi-team tournaments will be permitted within a zone. Full details of the new yellow alert level measures will be posted on the Government of New Brunswick website. Moving to the new yellow will be a testament to the efforts that all New Brunswickers have made over the last 2 months to bring post-holiday COVID-19 outbreaks under control. And I just want to remind people that this is not something to take lightly or take for granted. The amount of work and effort that all New Brunswickers have contributed to this success should be making everyone proud right now. It's not seen in other jurisdictions other than here in Atlantic Canada and perhaps places like New Zealand. So it is something that we really need to be proud of. Je vous remercie sincèrement et j'ai le plus grand respect pour tout ce que vous avez fait. C'est incroyable cet travail qu'on a fait collaborativement. C'est pas quelque chose qu'on voit dans d'autres endroits du pays, sauf que les provinces de l'Antarctique et peut-être d'autres pays comme la Nouvelle-Zélande. Ce n'est pas cependant pas le temps de nous reposer sur nos lauriers. You have my deepest thanks and utmost respect for all that you have done. But this is not the time to rest on our laurels. And the recent events in Newfoundland really demonstrate how quickly an outbreak with the new variants can spiral out of control. Everyone needs to be vigilant and continue to adhere to public health guidance and advice. And I know that it's even tempting for people who have received 2 doses of the vaccine to want to not continue to follow public health measures, but we really do need everybody to do that until a large proportion of our population is vaccinated. So we really need that critical cooperation and compliance with public health measures at this time. As more people get vaccinated, we all must continue to wear our masks and maintain that physical distance, because if we don't, we know that we can see outbreaks with the variants, and they come back with a vengeance, and they are fast and strong. So we have to remain very, very vigilant. It will also remain vital to track your close contacts, keep your numbers small. We've seen that transmission of the new variants can happen way before a first case is identified. So by the time a case is identified, they've already transmitted to their close contacts. So we really need to keep track very, very closely. Evidence shows that as jurisdictions have relaxed restrictions, friends and family remain at high risk for spreading infection. We all have to remain vigilant. And I just want to point out that the other things that make it so that we can make these changes are the facts that we have so many restrictions on travel right now. We've worked very closely with our partners at Department of Public Safety, and they have been instrumental in making sure that we can la force nécessaire pour poursuivre sur la bonne voie et traverser cette pandémie. Si chacun se soucie de soi-même et des autres, je vous assure que les choses vont s'améliorer, je vous le garantis. Merci beaucoup. Thank you very much.
Good afternoon. Bonjour. Before I begin today, I want to take a moment to address the heartbreaking loss of Lexi Dakin, a loss that is being felt across this entire province. I offer my deepest condolences to her friends, to her family, at this tragic time. The thoughts and prayers of all New Brunswickers are with you as we grieve this tragic loss. We all want answers to ensure what happened in the last few days does not happen again. We know we have to do better in our province to fix a system that lets down too many in their time of greatest need. And we will do better. I am confident that there are many people, many experts that can help us get a system that works for all. Throughout this pandemic, we have all had to be flexible. As the situation has changed or as new information has become available, we've had to act quickly and decisively to help keep you and your families healthy and safe. Nous avons de faire preuve de souplesse, et c'est pourquoi nous avons réservé ou assoupli les restrictions quand c'était nécessaire de le faire. Cela a été parfois difficile pour tout le monde. Mais vous avez toujours fait preuve de résilience et de compréhension parce que vous faites passer le bien-être de votre famille, de vos amis et de votre communauté avant tout. When we've had to make changes to directives at each of the alert levels, we have done so in partnership with public health, and we will continue to do that. When we've announced a few weeks ago we would be staying in orange, it was to allow time to get outbreaks under control, secure borders, determine the impact of the variants, and have a path forward for yellow and beyond. Je sais que c'était frustrant, mais cette mesure a également été efficace, et nous devrions être fiers de cela. Thanks so much for your efforts. We are now in a position to accept the recommendation of public health that adjustments be made to the orange alert level. Visits to hospital patients will be permitted with public health measures in place. If the facility has a capacity to allow this under their operational plan, we will work with each facility to ensure this is possible. We will soon be able to allow visits to patients in long-term care facilities as well, once the majority of staff and residents have received both doses of the vaccine, and enough time has passed to ensure that the vaccine has had time to take effect. Also, under Orange, compassionate travel to New Brunswick has been expanded to include those who are coming to the province to attend a funeral. Finally, within New Brunswick, travel across zones will now be permitted. Puisque toutes les zones sont actuellement orange, les gens peuvent voyager dans d'autres zones. Vous devrez toutefois maintenir votre bulle composée d'un seul ménage ainsi que votre groupe les mêmes dites lorsque vous voyagez dans une autre zone. These changes to the orange alert levels are effective as of midnight tonight. If we keep the number of new active cases low, and if our overall number of active cases in the province continues to decrease, we will be further loosening restrictions in just over a week. As Dr. Russell said, we've been working with public health on changes to the yellow alert level to ensure the health and safety of New Brunswickers. The plan is to have a revised yellow alert level go into effect province-wide on Sunday, March 7th at midnight. The information on the changes to orange and yellow will soon be on our website, if they are not already there. This will be at gnb.ca/coronavirus under Recovery Plan. We will continue to work with our neighboring provinces to reopen travel bubbles as soon as we can. We have all enjoyed the freedom that came with being able to travel safely to another Atlantic province. So let us get back there as quickly as possible, but let us do it safely. We know what we experienced over the Christmas holidays, and we've been over 2 months recovering. We must ensure that does not happen again over the March break. So let's look out at the end of the March break, and let us continue to move in a stronger yellow, back to an area we were much more comfortable in managing COVID, but all the while knowing that vaccines are becoming more readily available and that we really are at the tail end of a pandemic. So let's not loosen our ability to achieve it as quickly as possible. We can make these changes because tighter border controls have had the desired impact on reducing the spread of the virus, enabling us to allow for more movement within New Brunswick. Although we continue to encourage weekly testing for truck drivers and people who cross borders regularly for work, childcare, and custody, and for medical and veterinary care. This goal is to increase COVID-19 safety for these individuals, their families, and all New Brunswickers by detecting the virus early in the event anyone is exposed due to necessary travel. However, we are not enforcing weekly testing since testing is not easily available at this time. I know that the tighter border restrictions have been hard on many people, and I've heard the concerns, specifically from rotational workers and their families. En raison de nouveaux variants, nous avons mis en place des restrictions pour les personnes qui arrivent de l'extérieur de Nouveau-Brunswick, parce que le virus entre dans la province de cette manière. We have asked Public Health to put together a plan to help ease this burden. This plan will be presented to Cabinet and the All-Party Cabinet Committee on COVID-19 the second week of March. As soon as more information is available, we will share it with you. If we can keep the spread of the virus contained, the rules and the restrictions will continue to loosen as more people in the province are vaccinated. Je comprends que les gens sont heureux des changements apportés aujourd'hui et de fait que nous progressons vers la phase juin. Mais je demande à tout le monde de demeurer vigilant et de respecter les règles. Les menaces que présentent les nouveaux variants de la COVID-19 sont réels. Nous avons constaté à temps neuf que le virus peut se propager très rapidement quand nous lui donnons la possibilité de le faire. If we have outbreaks because of March break, we will not hesitate to move to stricter alert levels to gain control quickly, as we have done throughout this pandemic, even if that means going from yellow into a straight lockdown. We need people to stay healthy and stay safe. We need people to be vigilant as the vaccine rollout continues across this province. So far, more than 11,000 people have been fully vaccinated. Between this week and next, we are holding clinics for more than 8,800 residents and staff at 321 licensed long-term care residents. First dose clinics for all licensed long-term care facilities are expected to be completed by March 14th. Following that, the focus will be on offering vaccinations to healthcare workers, those living in First Nations communities, and people aged 85 years and older. It is anticipated that the vaccine supply will progressively increase in late March and into the second quarter of 2021. As well, today, Health Canada approved the AstraZeneca COVID-19 vaccine. This is indeed great news, and it provides another tool in our fight against this virus. We will share more information on this and how it will impact our supply of vaccines as soon as we are able to do so. Nous n'en sommes pas encore là, mais quand la situation va commencer à s'améliorer, elle va s'améliorer rapidement. Nous comprenons que plusieurs personnes de Nouveau-Brunswick sont prêtes à recevoir le vaccin. Je vous demande de continuer à être patient. If you want a vaccine, you will get it. While our vaccine is progressing, we must all continue to work together to slow the spread of COVID-19 and take the steps that we're doing right now as we see our case count dropping and we see our overall active cases dropping. We can continue to protect ourselves and our community during this time and while we're waiting for the vaccine supply. It is my hope that we will receive enough vaccines that it'll be like getting a flu shot. There will be lots available. It's just when it works for your schedule. But we're not there yet, and we don't have that quantity confirmed. But the future looks bright, and let's all be ready for it when it gets here. So we can't become complacent. It's not a time for us to let our guard down. It's a time to prove just how good we are, to be determined, as we have been throughout this entire pandemic, to meet the challenge ahead and finish strong. We can do this. New Brunswick has led the way, not only in Canada, but throughout the world. And we can make a difference. And New Brunswick is on the map for doing so. Let's finish first. Let's finish the way we started, dealing with a pandemic head on. Thank you. Merci.
Merci beaucoup, Monsieur le Premier ministre. Dr. Russell. Thank you, Premier. Thank you, Dr. Russell. Nous allons maintenant procéder aux questions des journalistes. Vous avez toujours le droit de poser votre question dans la langue de votre choix. Chaque journaliste aura une question et si le temps permet, on peut faire les suivis. Voulez-vous assurer de désactiver le son de vos micros? We'll now proceed with questions from members of the media. Each reporter will have one question. You have the right to pose your question in the language of your choice. If time permits, we will circle back for follow-ups. Please ensure your microphones are placed on mute. Laura Law, CTV.
Hi, thank you, Bruce. This question would be for either Dr. Russell or the Premier. I'm just looking for a little bit more information about the new yellow phase in terms of how we landed on this and why we're waiting until March 8th to roll out this new phase.
I'll start, and then if the Premier wants to add something, he can, and I'm sure he will. We've had many discussions since the variants have arrived in Canada around what types of measures we need to have in place to protect ourselves. And one of the things that we really were keen to make sure we had in place was making sure that we really minimize the number of travelers coming into the province, first and foremost, because that was obviously the way that COVID-19 was getting into the province. And then what measures are in place within the province that we need to maintain and continue to be as safe as possible, but as having the ability to share time with family and friends and be able to have small gatherings, etc. So how to balance all of those risks, knowing that at the same time that these things are happening, that we're concerned and very quickly trying to get everybody vaccinated in that vulnerable population. So our aim has always been to get the long-term care facility healthcare workers and residents vaccinated by the end of March. So these are all the things that were part of the discussion and needed to be part of the discussion to be able to do risk assessments and make the decisions around when and how to move to a more open phase past orange and into this new yellow phase.
Philip Hughes, Radio-Canada.
Bonjour, j'ai une question pour Mme Russell. Avec l'autorisation aujourd'hui par Santé Canada du vaccin d'AstraZeneca, est-ce que le Nouveau-Brunswick va l'administrer aux personnes de 65 ans et plus, ou vous allez adopter une posture similaire à certains pays européens et le déconseiller?
Il va falloir qu'on fasse des décisions sur ça parce que l'annonce aujourd'hui avec la Santé Canada, il y avait promis une restriction sur l'âge. Mais oui, on est au courant qu'il y a d'autres endroits où c'est seulement les gens qui sont en bas de l'âge de 65 ou en bas.
Merci. Hadil Ibrahim, CBC.
Thank you. This is a question for Premier Higgs. Does moving to this new yellow mean anything for self-isolation restrictions or any kind of return to the Atlantic bubble?
Well, I think any progression to moving from orange or a modified orange and moving into yellow brings us closer to the Atlantic bubble option. So certainly our quarantine 14-day isolation is still in effect, and that has not changed. But I would definitely say that this is directionally right without question. The announcement of more vaccines becoming available and determining just what that looks like is all good news. So at this stage, looking forward to the Atlantic bubble as we once knew it is a definite possibility for late in the spring and summer. And let's hope we can move that into a cross-Canada bubble as vaccines roll out, but a little early to make that prediction.
Thank you, Premier. Andrew Cromwell, Global TV.
Question for Premier Higgs. Premier, you mentioned the March break a couple of times. Can you say how concerned you are, at what level in terms of possible spread during that period?
I am very concerned. Prior to the Christmas and New Year's break, we cautioned, Dr. Russell and I repeatedly cautioned about large gatherings, and we'd had a great run up to that point, and I think that generally the public felt, well, we see it happening all around us, but not in New Brunswick. Well, we got a wake-up call, and I'm hopeful that people do not forget that wake-up call that we got over the Christmas and New Year's break. So here we have another break, but we have proven that we're able to manage the COVID back down to normal or reasonable situation. That's going to get easier as more people get vaccinated. So if we do not blow it right now in this time period, it looks like blue sky beyond that. But we know that complacency can be difficult. I'm just hoping the last 2 months of what we've experienced will be fresh in people's minds. The experience and what we just saw in Newfoundland in the last few weeks will be very fresh in people's minds, and they will say, we can do this. I can do my part. Yes, I might be out in the woods with my buddies, but I can keep a distance. I can follow the rules no matter where I am or what I'm doing. It's the role that each of us can play that'll make the difference.
Thank you. Nathan DeLong, Miramichi Leader.
Good afternoon. My question is for Dr. Russell or the Premier, whichever one can answer. You've talked a bit about trying to keep people's mental health in mind with changes to the restrictions to allow increased gatherings, but limiting the size of them at the same time. And we've heard a lot of anecdotes about the impacts, societal and economic, of the pandemic, such as business closures, mental health, that type of thing. I'm wondering if the province keeps track of how many businesses have closed their doors in New Brunswick since the pandemic began, or if there's any data available on the mental health impacts or issues such as substance abuse, prescriptions for mental illness, homelessness, food insecurity, deaths by suicide, and if you know how these numbers compare to previous years.
I think the Premier's going to start around the businesses.
So I will start in what we do monitor very closely in terms of the business activity and the number of businesses and the situation they're in. I mean, the programs that we've offered were based on direct conversations with businesses in their situation and what that looks like. From the very beginning, our goal has been to try to keep businesses open as much as possible so that they didn't experience a shutdown, and we've been able to do that for the most part. Obviously, up north in the last few months was a little different, but we have very good records of where we are in comparison to other provinces, our recovery in comparison to other provinces, and then of course our goal is going beyond COVID. We also have good stats, and I'm sure Dr. Russell will comment in this regard, but I think the other thing, the statistic that we're keeping close watch on would be certainly issues related to mental health and addiction, the number of infractions, in terms of increased crimes and such, so that we're assessing that. And as I mentioned, it's certainly a very unfortunate situation in this last couple of days. We want to understand, all the issues that are surrounding any critical situation and like we've witnessed and what caused that, but also the other trends that we see. So we're working closely with authorities in that regard. And then I'm sure the specific situation of isolation and what that means to mental health and missing that social fabric is another whole issue as we moved out of this, that we're looking forward to changes, and today's changes will help in that regard.
With respect to mental health and addictions and homelessness, et cetera, certainly prior to the pandemic, these were issues that were being addressed and understood in terms of what actions needed, what the gaps were. And this week, there was an announcement by Minister Shepherd around the new mental health and addictions strategy moving forward, which has a lot of really important key components in it, including some walk-in resources for mental health and addictions. And also some upstream prevention pieces, which are also being implemented and piloted in terms of the Icelandic model for decreasing substance use in youth. And with respect to the pandemic and the decisions that we've made all along and balancing the social determinants of health, they've always been part of the conversation, no matter what decision we've made around balancing and managing risks of COVID-19, along with all of the other unintended consequences and negative impacts.
Vicky Hooker, hold
Can
on.
I add another point?
Sure you can.
And it's in relation to the rental issue, because that's been on top of mind, and homelessness, and do we have adequate supply of affordable housing, excuse me. And to that point, you know, we have kind of a 90-day project underway to assess it across the province, working with municipalities and ensuring that what we know is real and what situations people are facing are as well understood, and what remedies that we can put in place will indeed be done. That project is I say, a 90-day project working with multiple departments as well as external stakeholders, and the completion date is May 10th.
Thank you.
Vicky Hooker, CHCO.
Thank you, Bruce. My question is either for Dr. Russell or Premier Higgs. Just for clarity, did you say earlier that New Brunswickers can travel between health zones as of midnight tonight? And if so, what led to this decision? Was accommodating spring break travel a factor?
I think in that regard, what we're looking at, working with public health, was in relation to saying, you know, before we were successful moving around the province, and it's kind of the next step, and many people were saying, well, I have friends, relatives, cousins, brothers that are living just in a zone next to me, and I'm not supposed to visit them, even though they wouldn't override my bubble. So I think the idea is, again, showing in good faith that we can move a little bit. We can allow people to move within the province. We want to give people hope. And you know, had we gone to a full yellow before the March break, it was like, okay, well, everything's good now. We're good to go. And it would be, hold it now. We have a pandemic still. We don't have all the vaccines. So recognizing we're not there yet, we want people to have a little more freedom throughout the March break to follow the rules closely, but be able to move within the province and get back to what we can have even more of if we don't lose control over the coming week.
Thank you, Premier. Cédric, l'Acadie Nouvelle.
Oui, bonjour. Une question soit pour le Dr. Rousseau, soit pour le Premier ministre Higgs. Est-ce qu'il pourrait être prévu de vacciner en priorité les habitants de certaines zones géographiques plus à risque? Je pense au Restigouche, par exemple.
Notre stratégie d'immunisation, c'est vraiment basé sur des suggestions, des directives au niveau national et aussi de l'organisme d'immunisation au niveau national. Et les groupes de priorité ici au Nouveau-Brunswick, c'est vraiment les résidents et les travailleurs de santé dans les résidences à long terme, les foyers de soins. Et en termes de priorité, je crois que ceux qui étaient plus proches des frontières étaient priorité, mais ils vont tous être vaccinés d'ici à la fin de mars. Et aussi, les populations autochtones des Premières Nations sont inclus dans les populations dans la première phase. Alors, c'est ça, la priorité, c'est vraiment fait au niveau national et ici au Nouveau-Brunswick avec l'information qu'on savait sur nos risques plus proches des frontières.
Merci. Michel Corriveau, Radio-Canada.
Bonjour, c'est une question pour le Premier ministre Higgs. C'est une question sur l'annonce qui a été faite aujourd'hui, les nominations des commissaires pour la révision de la langue sur les lois officielles. Monsieur le Premier ministre, j'aimerais savoir quand les consultations vont commencer et quel est le mandat des deux commissaires.
So the next step, and I've spoken to both of the individuals. I feel very good about the qualifications of both commissioners. I feel we're going to have a good cross section here. But the next step is to meet with them, and then meet with each other, and basically outline the terms of reference and the timelines. So and putting the format together. So I didn't put any particular format in the sense of what they think might work best. I want to spend that time to understand directly with them, with myself and folks in my office. So we will determine that, and the goal would be throughout maybe, but let's say I'll kind of target the third week of March, second to third week of March. But we got a March break in the middle there. But to put the terms of reference and let both of the commissioners speak to that when they bring forward their outline, defining the process, and the timelines which we want to adhere to.
Merci beaucoup, Monsieur le Premier Ministre. Marie Sutherland, CBC.
Good afternoon. A question for either Dr. Russell or Premier Higgs. Will students need to wear masks in class in this new yellow phase? I believe it was an exception in the former yellow phase.
So that would be dependent on what they were doing in the last yellow phase. So the places whereby they were able to physically distance, they could, but it depends on the situation of each school. But my understanding is that for the high school students that they would be able to remove their masks, but it would be again dependent on the operational plans of each school.
Thank you. Timothy Jakes, Hamilton Tribune.
Yes, my question's for the Premier. Last night, the Restigouche Regional Service Commission expressed its concern that the current border restrictions are having a hard effect on the regional economy in eastern Restigouche, which relies heavily on business from Quebec. They said it would be like putting a barrier up between Moncton and Dieppe or on the bridges in Fredericton. Given there are now no cases in Zone 5 and one on the Gaspé Peninsula, will the Restigouche regional economy now be more of a concern for government?
Well, I think every economy is a concern, and what the viability of each community is and who they rely on to maintain that. So, yes, it's obviously a concern. And I think as we move the next step and as we watch what's happening across our neighbor in Quebec, what we can do differently, we'll be looking at that. But I think for right now, we've defined a process that is seeing things improving and recognizing that. And I would like to think that the Restigouche region would look at that as very positive signs of us moving closer to having, let's say, a greater freedom at the border. But we're not there yet. And we have to, take a little while longer before we think we can open up. We've only recently, and I say recently, it's been in the last month or so, we've tightened down there and monitored traffic very closely to essential services and limiting trips because of what we've experienced. Let's give us a few weeks and to understand, is that experience going to hold? And let's understand what the vaccine program rollout looks like.
Thank you, Premier. Mathieu Boiscomont, l'Acadie Nouvelle.
Bonjour, ma question est pour le Premier ministre Higgs. Au sujet des commissaires Fitz et McCaughlin, pouvez-vous me dire si les deux sont bilingues en français et en anglais et si ce que vous avez appelé leur terme de référence sera rendu public lorsqu'ils seront prêts?
Firstly, certainly, Justice Finn is fluently bilingual. John McLaughlin is. He didn't refer to that he was fluently bilingual, but he spent a good portion of his career as deputy minister in the Anglophone system and in education in its entirety. And as you know, a big part of this whole mandate is trying to balance out for both Anglophone and Francophone sectors to review the Official Languages Act, and the second phase of the program is to understand how we can be more successful in graduating our kids across this province in both official languages. So I think we have a very good mix there of certainly skills and capabilities. And yes, the terms of reference and the information around how the commissioner's role and how the process will be guided will be made public.
Tom Bateman, Brunswick News.
Good afternoon. I wonder what sort of size or scope of a COVID outbreak would need to occur to disrupt, our path to yellow, or, if we're in the yellow phase, to kind of, bring us back to orange. For example, would the kind of clusters we're seeing in the last few days in Nova Scotia or PEI be enough to kind of bring us back a step?
Tom, hi there. It really depends on the situation. Again, with the variants, we know that if there are enough people that are close contacts and the first positive case has already transmitted to all of their close contacts, then that's a problem. But certainly we do have some revised phase triggers based on the variants so that we can clamp down pretty quickly, pretty hard, so that we don't get into a situation where the variants get ahead of us. And so basically, the changes that we're looking at in terms of our phase triggers based on the variants for our risk assessments, because the triggers are the triggers to have a conversation about the risks and make an assessment on those risks. So an indication of a super spreader event whereby 10% of attendees develop symptoms in a gathering with a minimum of 20 attendees. Also, making sure that 10% or more of if 10% or more of the contacts could not be traced by public health within 24 hours after being identified through the case interviews, that's a new trigger. And then also compliance with public health directives. By that we mean poor record keeping at businesses, indication which we do have work with Department of Public Safety that helps us with that in terms of collecting that information, and then large numbers of public exposures at high traffic venues such as concerts, bars, and schools. And the other phase triggers based on the new variants would be an inability to scale up to sustain a sudden increase in ICU cases from the current census, including staffing. So it's not really just about admissions, but it's also about how many staff are affected and are not working because of self-isolation, et cetera. And if this health system could no longer screen and test the required number of symptomatic patients in a timely manner, so 24 hours for priority groups and 48 hours for others, not including the lab turnaround time, and making sure that that there is not a threat to the baseline capacity of clinical health services. And I have to say that during the entire pandemic, with the exception of the first lockdown, we've been exceptional at being able to provide services to patients all around the province with respect to non-COVID related issues, because the numbers of COVID cases have been so low. And then the last one would be increasing the number of an increasing number of new healthcare worker infections, which is affecting the workforce and indicating poor infection prevention and control practices, and large numbers of healthcare workers that are under self-isolation, which is affecting the ability to deliver healthcare services.
Thank you. Savannah Odd.
Hi there. My question is for Dr. Russell. The George Dumont lab has told me that they can't test for variants right now because it requires a very labor-intensive process. They need to hire someone to do it. The Department of Health has told me there's no financial barrier or any other barrier to the lab hiring someone. So I guess I'm wondering, can you tell me where we are with getting that capacity for variant testing up and running? Have there been challenges in hiring someone?
Well, the conversations that I've had and the email traffic that I've participated in on that involves the fact that we will be able to screen for the variants. That actual sequencing, you're right, does take a bit longer and is more labor intensive. And my understanding is that that there would be an opportunity to hire somebody else if we needed to. But in the meantime, again, there's many processes that have to happen. But in the meantime, we're told that we would be able to do the screening part of the variants sooner rather than later. But I don't have an exact timeline. But I was very encouraged by the conversations around what the possibilities were. So that's good news, because obviously having to wait a week in terms of turnaround time, sending things to the National Microbiology Laboratory in Winnipeg, obviously is a a long period of time when you're dealing with an outbreak that could be related to a variant. But certainly the transmission pattern would probably be making us suspicious enough in that case that we would probably put actions in place ahead of getting that information back about a variant. So I think it's good to have that confirmation. We will have the ability to do the screen so that we'd have that turnaround time be much quicker.
Thank you. Jean-François Boisvert, l'Acadie Nouvelle.
Oui, ça serait pour le docteur Russell, s'il vous plaît. On m'indique qu'il y a eu une campagne de vaccination massive au sein de la Première Nation autochtone de l'Estigouche en Gaspésie et que pratiquement tous les citoyens de l'endroit ont reçu leur vaccin contre la COVID-19. Je me demandais donc, est-ce que c'est une nouvelle étape pour cette Première Nation pourrait mener vers un relâchement des mesures à la frontière pour cette communauté précise et même un retour peut-être des élèves de l'école de cette Première Nation à Hamilton avant la fin de l'année scolaire?
C'est une bonne question. Les détails sur les changements, les frontières, etc., on n'a pas eu de discussions sur ça ou des décisions n'ont pas été faites sur ça à ce moment-ci, mais on va continuer à regarder les situations sur l'autre côté des frontières.
Clara Cosica, Brunswick News.
Good afternoon. My question is for either Dr. Russell or the Premier. It concerns nationally carded athletes, of which there are a handful in New Brunswick who are preparing for Olympic trials. So there are carded swimmers who, in orange and red, they have not been able to train in the only Olympic-sized pool, which is in the St. John region if they live outside of this region. So this has been, I suppose, solved in the orange phase, but they're worried that if they go back into red phase, they won't be able to train. They've cited that almost all other provinces in the country have made an exemption for high-performing carded athletes to be able to continue training, even during quite lockdown phase equivalents in other provinces. Is this something that you would be looking further into? Or will these athletes have to deal with an uncertainty that none of their competitors are having to deal with as they approach the May trials?
Thank you for the question, Savannah. Clara. We have had those requests, and you're correct. There haven't been any exceptions made at this point in time. Again, we have been very vigilant and pretty strict about exemptions and exceptions in these situations. But certainly, moving forward, we can take that back and have more discussions. But up until now, we haven't been giving exemptions.
Thank you very much, everyone. That concludes today's update. Voilà la fin de notre mise à jour. Merci beaucoup.